Okay, let's unpack this. Vitamin D supplements. They are just everywhere, right?
Yeah.
Filling shelves, medicine cabinets. But is all vitamin D really, the same? Today, we're diving into a listener's question, a really fascinating one, actually, that gets to the heart of maybe a common misunderstanding. Why do doctors sometimes prescribe active vitamin D, the stuff that works, while, loads of these inactive supplements might not be doing what people think, even though they supposedly convert in the body?
Absolutely. And what the research, especially Professor Lin's work, which is really pivotal here, what it uncovers is this critical difference, a difference between what we think is good for us, our perception, and the actual sort of intricate physiological stuff happening inside. We're going to challenge some assumptions today, I think, about these healthy supplements and hopefully give you some tools for, critical thinking about your health decisions.
Okay, so let's picture vitamin D's journey, right? Whether it's sunshine hitting your skin or you're eating fatty fish, eggs, that kind of thing.
Sort of pill, yeah.
Or popping that supplement pill, exactly. The form you start with is always this inactive vitamin D. So this stuff travels to your liver first, and there it converts into this intermediate form. Let's call it pre-active D, just to keep it clear.
Okay, yeah.
And this first step, zero regulation. It just happens. Doesn't matter how much you take in. Think of it like an open highway, maybe. No speed limits, no cops.
Exactly. An open highway, anything goes. But, and this is where Professor Lin's work really highlights the crucial bit. Here's where it gets really interesting. That pre-active D, it then goes off to your kidneys.
Okay.
And there it becomes the real deal.
Oh.
1025 dihydroxyvitamin D. That's the active vitamin D. Calcitriol is the other name for it.
Right, the active stuff.
And this second step, converting pre-active to active, it's strictly controlled. Your body is incredibly smart about this. It speeds up the conversion if you need more calcium, maybe for your bones, and it slams on the brakes, slows it right down if you've got enough. It's like this perfect internal dimmer switch, just calibrating exactly what's needed. That regulation, that is the absolute game changer.
Yeah, that tightly regulated kidney step. That sounds like where things could potentially go wrong then. Because with vitamin D from, say, sun or food, your body's own control system, it works fine, right? Like a careful gatekeeper stops you making too much.
Precisely.
But Professor Lin's research, it shows something kind of surprising, that taking large doses of the inactive stuff from supplements, it can actually overwhelm that careful gatekeeper.
Exactly. It can flood the system. We've seen documented cases, people thinking, more must be better. And they inadvertently push their bodies too far. You get an overproduction of the active vitamin D. And that can cause vitamin D toxicity,
right,
which isn't just a mild side effect. We're talking potentially severe consequences like acute kidney failure even. It's a serious imbalance.
Wow, okay.
And this goes straight back to the excellent question you asked about doctors prescribing the active form. Yes, doctors do prescribe active vitamin D like calcitriol for very specific medical conditions. And yes, it is effective for those conditions. But, and this is key, they have to rigorously monitor those patients. Check blood levels. Watch out for toxicity risk. It's all spelled out in medical guidelines.
Right, careful monitoring.
But with the non-prescription inactive supplements you buy over the counter, that critical medical monitoring just isn't there. So for you, the person taking them, the actual effectiveness you're getting and the risk you might be taking.
Well, it's a bit of a gray area, isn't it? Kind of a roll of the dice. So, okay, putting it all together. What does this mean for your health choices when you're standing in that supplement aisle? The simple idea that, inactive just becomes active safely, no problem. That sounds like the myth Professor Lin's work helps us debunk.
Precisely. That's the myth. The real distinction isn't just the name on the bottle. It's about your body's own control system and the potential consequences when that system gets bypassed or overwhelmed. And well, Professor Lin also brings up another factor, sort of a non-medical one maybe, but worth thinking about.
Oh.
While doctors don't directly profit from prescribing active vitamin D, the regulated medicine, recommending or even selling the inactive supplements, that can be quite profitable for others in the health space.
That's an interesting point to consider too.
Yeah, and if we just zoom out for a second, connect this to the bigger picture, it's really a powerful lesson in, critical thinking. It's about looking past the marketing hype, understanding the why.
Yeah.
Why is this recommended by a doctor versus why is this sold everywhere? Don't let what seems like a simple vitamin hide this really complex reality going on inside your body. Your body's own wisdom is much more sophisticated than a supplement label sometimes suggests. So next time you hear health claims, maybe about any supplement, remember to look for those nuances. Think about regulation. Think about risk. Knowledge like this, these deeper insights, they're most valuable when you really understand them and, apply them.
Definitely food for thought. What really stands out to you about this whole journey of vitamin D inside the body? And how might really grasping this complexity change how you approach health information or even just browsing those supplement aisles next time?